Hi everyone, and welcome to another Wellness Wednesday. This is Dr. Whitney, Dr. Mom ND, and for those of you joining me for the very first time, I am a naturopathic doctor that has a primarily mom and kid based focused practice since I've had two children of my own, 4 and 2 little boys now, 21 months apart, which is a story all of its own. That's just where my practice has trended towards. So I wanted to just kind of come back today and go back to the basics. I've had a few people reach out to me, as they always do in the first few weeks of a new year, wanting to know what I have, what I offer, to get them started on the path to health and wellness. Maybe it's, not necessarily entirely fueled by weight loss, but wanting to make healthy changes to get themselves to a healthier place. And maybe part of that entails some weight loss. So if you are a health conscious, currently pregnant mom, or one that is trying to bounce back after baby, I've seen a few people lately also really struggling with their pregnancy in terms of nausea, just really struggling with food and being sick a lot. And that sucks. Like, pregnancy should be a great time, right? So just all these things got me thinking this week. Really, if I could reach out with a magic wand and just, touch all of these people and give them all the same message, what would that message be? So that was what I wanted to talk about today. Basically how your food intolerances still remain one of the most foundational ways for you to address your whole health, right? Because ultimately it is the underlying cause for the majority of inflammation in your body. So before I lose anyone, okay, let's just back up. Food intolerances, the very, very, very first thing you need to know is it is not a lactose intolerance. That is not what we're talking about. This is totally and completely different, okay? It is such a misnomer, and that confuses people so much. Secondly, if you're tuning in and you're like, oh no, I already know all about food issues. I've had, sensitivity or allergy testing done, or some other practitioner did some kind of testing on you and told you about foods. No, and no, okay? The Carroll method of food intolerance is unique to naturopathic physicians only. They either are working with or trained by other naturopathic physicians affiliated with, teaching for, on behalf of the Carroll Institute. Okay, so you can look this up, Carroll Institute, I think it's .org. For the first few years in my practice, because of pregnancies and babies and nursing, I was not able to do the training to do this method of dietary assessment on my own. So I was taking samples on my patients, a simple finger prick, a few drops of dried blood, and sending that out to the Carroll Institute, to the practitioners there, and then they would run the test for me. Now, about 3 years ago now, I was able to finally go out to Spokane, Washington and do the training. So as far as I know, I am the only licensed, well, in Minnesota it's called a registration, naturopathic doctor in the state of Wisconsin that not only does the Carroll method personally on site in office, but also offers it via mail order, right? So I've got it all set up. The kit is so simple to do because it really is just a finger prick with a little cartridge, like how diabetics test their blood glucose every day, fully housed in a little cartridge that you just put on your finger, press a button, and then get a few drops of blood. So that's easy to do. So I can send that to people. They can do it at home and send it back to me, and we can do the whole thing via telehealth, which is another thing that I've been getting questions about in the last few days, people wanting to know from afar. I think someone in Florida, someone in New York, a couple people out west, all wanting to, do you do this by, telehealth? How does it work? It's very simple. So I send you the kit, you do your forms electronically online, I run the test, get results confirmed, and within a week or two, the Institute will confirm my findings so that we do the follow-up at that time. So understanding what the food intolerance is actually really, really simple, okay? So First, it's just understanding that allergies and sensitivities have to do with your immune system. Okay, so with allergies, there are different types of allergies, right? So if you're someone who has to carry around an EpiPen with you because of a bee sting or a peanut allergy, that's considered a type 1 hypersensitivity reaction. That's mediated by IgE cells in your immune system. Now, lesser reactions by your immune system are type 2, type 3, type 4 hypersensitivity reactions. These are mediated by receptors called IgG or IgA. And that is what is being looked at when people go out and do these really expensive, really big panels that, cover 800 things for their food sensitivities or allergies or whatever they're getting done, however that's being worded. But again, understand that they're provoking your immune system, which is why so much blood has to be taken, and why ultimately it's not going to get to the root of the problem, okay? So this is akin to an analogy of a car that has a leaky gas tank, and instead of fixing the leak, you just keep changing the type of gas you're putting in, okay? So in order to have had a previous reaction, right? So that's one thing people ask me, well, how can you test me for foods if I've already been avoiding dairy and, gluten and stuff like that? Because it doesn't matter. Because with food intolerances, with true intolerances, you were born this way. It has to do with a combination of genetic, enzymatic functions in how your body works. So the first thing is to understand that when there's inflammation present in your gut, it will damage your gut and create leaky gut. So all of these tests that do allergy or food sensitivity testing, all they're ultimately doing is confirming that you have leaky gut. Because if the stuff in your gut is getting outside of your gut, it's triggering your immune system to respond, and that response is the symptoms you're experiencing, right? So your immune system has been sensitized to respond to that particular thing being somewhere it shouldn't. So again, rather than fix the leaky gut, remove the inflammation, what they're telling you is, oh, your immune system's responding to spinach. Stop eating spinach. That literally is the dumbest thing I've ever heard. Spinach is one of the healthiest things you could possibly eat. How could your body have an allergic reaction to spinach? I mean, it boggles the mind. I'm sorry. If you've been following me long enough, you know this is how I am. It boggles the mind. So ultimately, when you talk about getting to the root of the problem, if a practitioner is actually talking about getting to the root of the problem, addressing the root cause, then they have to address the leak, right? What caused the leak, not what's leaking out. Okay, so that's where naturopathic medicine really addresses the root cause, right? You have to start with the digestive system. That's where everything starts. It's like 80% of your serotonin is made in there. So all of your mood disorders, your anxiety, your depression, your sleep, all that stuff comes from your gut. There's a direct gut-brain connection. Not to mention just digestive stuff in general, skin issues. Your cells of your skin have the same embryological root as your gut. They're directly connected. So anything on your skin is just an expression of the health of your gut on the inside, basically, or basically your gut saying, I need help, and using your skin as a backup. So there's lots and lots and lots of reasons, obviously. Even Hippocrates knew that basically, the root of all health resided in the gut. So there's lots of historical physicians and quotes and things talking about how all diseases are the same disease, an imbalance in the function of the body, inflammation in the gut, that the gut needs to be optimal. So Dr. Carroll had a son who, despite all of his naturopathic training, right, with botanical medicine and homeopathy, he couldn't figure out how to get his son better. And he took the work of another guy, Dr. Abrams, who was basically a scientist, but also a teacher, I think affiliated with one of the Ivy League institutions at the time. And he was experimenting at a time with a method of diagnosis that involved using frequency. So you have to remember that this is also at a time before there were accepted methods of diagnosis per the AMA. So in this time, lots of people were trying to figure out different ways of finding out what was wrong with people. So Dr. Abrams was using frequency. Dr. Carroll modified that and included food, and was able to then find out foods that were compatible with a person's digestive system or not. So ultimately, he figured out that his son was unable to properly digest or handle fruit. And once he removed that from his son's diet, his son finally got better. So it really is on the one hand, it's such a simple thing to do, but on the other hand, it is the most clinically significant thing that I have seen personally, as well as the practitioners who taught me, who have been doing this for over 40 years. And they are the third generation. I'm the fourth generation to be doing this as a naturopathic physician. So again, food intolerances are whole groups of food that you basically have an inherent genetic inability to properly digest and metabolize. So it's not just digesting it, it's what your body does with it afterwards. And if it can't do what it needs to do properly, it basically creates what we call a system of toxemia, and that ultimately leads to chronic cumulative inflammation that can disrupt any organ or any system in the whole body. So yes, it does not matter what your issue is. This is always going to be the first thing I'm going to suggest, because we need to get your digestive system back on track. We need to get all of the organs cleaned out, restored, detoxed, whatever you want to say. I use a lot of homeopathy in conjunction with the Carroll method of food intolerance to kind of come at this from both sides then. So some people, depending on how long they've had their issues or how complex they are, if it's been something relatively newer, something relatively simple, sometimes just doing the Carroll method is enough to get things back on track. Other people need a little extra help to deal with all of that old built up stuff as well. So let me just go through. I have a handout that I give to people that has some information, and I think I've covered all of it. Dr. Carroll, he was a naturopathic doctor in Spokane in the early 1900s. How he modified Dr. Abrams' work, how he helped his son. The primary groups are fruit, dairy, sugar, potato, and egg. The combinations vary. There's potato grain, fruit sugar, dairy sugar, grain sugar. As you can see, sugar's in there a lot. But ultimately, it's a great way to both do for yourself, your new baby, or a baby who's going to start eating food soon, or a baby that you just had, because I have seen both with mothers who are nursing that if they avoid their food intolerances as well as their baby's food intolerances, that the baby does better. So sometimes the mom can just avoid baby's food intolerance, but I have seen moms who also needed to avoid their food intolerance as well. And again, if you are a pregnant mom that is struggling right now, you should find out your food intolerances, because my guess is that would help a lot. And then is the first step to introducing food to your new baby. Or when your baby gets old enough, this is a great way, again, to customize that first food. So I was following the Nourishing Traditions stuff for my firstborn, and per that, I should have given him grass-fed beef liver and egg yolks. But when I did his food intolerance, I found out that he was egg intolerant. So what a good thing to do, right? I didn't start him off on the wrong foot by giving him the one thing that was not compatible with his body, that wouldn't have fueled health for him, that would have fueled imbalance and inflammation and illness instead. So if you have questions, please let me know. But again, this is overall, I think, a good synopsis of what the food intolerance, the Carroll method is, the approach, and why it is so foundational. So use this for yourself, for your friends and family, and I'm going to hopefully use this video as a method to share going forward with anybody who has these basic questions. So again, Dr. Whitney, Dr. Mom ND with Holistic Home Health and Wellness for another Wellness Wednesday. Thanks for joining me.